Good morning. There were 11 new cases of COVID-19 recorded in the Northern Territory in the last 24 hours, bringing the cluster to a total of 51 cases. One of them is of serious concern. I'll explain that case now. Last night, 4 people from the Binjari community evaded authorities, left the hard lockdown and travelled by taxi into Katherine. One of these people is a woman who was positive for COVID-19. The result was confirmed this morning. The woman did not know that she had COVID-19. She was at large in Katherine and she was infectious. She was found about 10 minutes ago by police at a location in Katherine. As well as the 3 people she left Binjari with, there were 7 others at the location. All 11 are now going to the Centre for National Resilience, and urgent work is being done to determine any other close contacts. Every police resource on hand was thrown at this to locate the case. The Commissioner will talk more about this in a minute. I just want to thank his team for their incredible work this morning. In about an hour, they found out about a positive case at large in the community and found her. That is outstanding. The positive case shows why the hard lockdown in Binjari is so critical and why acting illegally to avoid the hard lockdown is so dangerous. It also shows why the lockdown in Katherine is still so important. There was a positive case on the streets of Katherine. So if you do not, I will go through what we know about the other 10 positive cases now. 3 are children from the same family. One of the children was already at the Centre for National Resilience, quarantining with her mother, who was a previous positive case. 2 other children were quarantining with their father at their home in Katherine East. Those 2 have now tested positive and they were transferred to the Centre for National Resilience overnight with their dad, who is symptomatic but so far testing negative. That family is now together in the Centre for National Resilience, receiving the best care. The other 7 cases are all close contacts who are already in the Centre for National Resilience. They just came through this morning, so we do not have all the details yet. We do know that 5 of these are from the Binjari community and 2 were from Robertson River. We believe they've only become infectious while in the Centre for National Resilience, so that is good news. So to run through the 11, 8 tested positive while quarantining at the Centre for National Resilience, 2 tested positive while quarantining at home in Katherine, and 1 was positive in the community briefly, but is now accounted for. To the wastewater testing. The Bicentennial Road catchment in Katherine East has remained positive. This is to be expected as that's where the kids were, and it could explain the persistent positives that we have been getting there. The Katherine Golf Course catchment has now turned negative, and we now believe we can link a previous positive cases to the positive reading we had from the weekend, so we are happy with that. The Binjari wastewater is still positive, but the signal isn't as strong as it was a few days ago, so that is good. The Rockhole wastewater is negative, which is very encouraging. And finally, there is a presumptive positive in the Berrima catchment. That's not a cause for alarm. We will retest that, but it is a reminder to everyone in Darwin to get tested if symptomatic. There were 3,519 tests processed in the Territory in 24 hours to midnight last night. That is a huge effort, thank you. This includes all of the day 5 testing in Binjari. We did 172 tests there yesterday. We already have 1 positive from those tests, the case that is unaccounted for in Katherine, and we may have more positive results as we get more through the lab today. Incredibly, we've done more than 5,500 tests in Katherine in the past 8 days. That is mammoth. Thank you to everyone in Katherine getting tested. The close contact numbers now stand at 471. 462 are located and isolated. These contacts have returned 433 negative results so far. 2 exposure sites. We are upgrading a casual contact site in Katherine to a close contact site. It is the McDonald's restaurant on Saturday the 13th of November between 11 a.m. and 11:25 a.m. This was Mac Happy Day. It was very busy on that Saturday. Investigations have determined that there were 4 positive cases there at the same time, making it very high risk, confirming 4 cases separately there at the same time. This was a week and a half ago. so there is not long left in the replication cycle. But to be absolutely sure, we need everyone who was there for McHappy Day at that time to make immediate contact if you haven't already. Another close contact site has been downgraded to a casual contact site. That's the Centrelink in Katherine that we listed as a close contact site on Monday. The date is Monday the 15th, the time period is 9:44 a.m. to 10:36 a.m. That is now a casual contact site, but that still means you need to get tested if you were there at the time. There will definitely be new exposure sites listed after interviewing the positive case that was unaccounted for in Katherine this morning. So please keep listening for updates because she was infectious in the community. These will be high-risk sites. That was concerning this morning. There is plenty of good news as well. 10 of our positive cases are in quarantine. The links are clear and they help explain our positive wastewater results. I'll pass to Dr. Payne now and then the Police Commissioner.
Thank you, Chief Minister. Thank you for coming. Yes, so we're reassured that the new cases we have, although the number is significant, are contained. They're mostly in quarantine. It is, of course, concerning about this individual who was known to be in that community and from Binjari had left. And obviously there will be a significant contact tracing effort now required to follow that up. The other cases, Robinson River, again, were two of them there, from there, but in CNR, were expected. The wastewater testing, I'll speak about that briefly, is now reassuring. It is positive where we would expect it, and we have explanations for golf course, as we've said, and that's turned negative. It is still positive in Bicentennial. That's probably explained by the cases that we've seen, the new cases, but there still needs to be significant testing in that area. Now turn to vaccination. There has been a significant effort in the last few days, particularly in Katherine East, but around Katherine, to get people vaccinated. In the next 2 weeks, anyone who has not had their first vaccination in the Territory has really no reason not to get vaccinated. I would ask people to come forward now. It is extremely important that we now get as highly vaccinated as we possibly can. We know that when it becomes endemic and when there is a significant outbreaks in the Territory, they will be reasonably well contained, we hope, but nevertheless, at the levels that we expect, the health system will remain capable of dealing with it, but we don't need that extra burden. So I really need people to come forward, please, and get vaccinated. If you're still hesitant, there's plenty of advice around to help you think that through. If you feel now that you should come forward, you can make a booking, and also there will be significant effort now to moving around the Territory, particularly in remote communities, to make vaccination available. Please come forward. Thank you.
Good morning, everybody. Unfortunately, our resources had to be diverted to focus on the 4 that left the Binjari community overnight. Incredible effort on the part of my police officers to round these people up. Unfortunately, they were found in a public housing property along the Vic Highway. As a result of that, there's now 11 people, those 4 plus the 7 that were in that property, all going to go into being close contacts. The taxi driver, obviously we've got to do some mitigation there, but the taxi driver's a close contact. That taxi will be off the road until it goes through a full cleanse before it can go back into operation. They wanted to the caravan park, that's where they called the taxi, so we'll have to work in with CDC to identify what exposure may have been at the caravan park as well, and if that information comes to the fore, that'll be put up on the website. As a result of that, my already stretched resources, we're going to have to put some further contingencies in place to ensure that the lockdown is in place for Binjari. You can see the impact of this activity in noting that the individual at the centre of this was not aware that she was positive. What it's now done is immediately impacted at least 12 lives, if not several thousand people who live in Katherine. That's how serious this is. She is positive. And the transmissibility that we've seen so far should not give us time for comfort. In fact, it gives us time for concern. $5,024 fines will likely flow to at least her, if not the 3 others, once we do an inquiry as to what reasons they could have possibly provided to leave. But let me be very, very clear to everybody, because there's a lot of mischief out there. There is nothing that the Binjari community, who are currently under lockdown, cannot reasonably get from us to provide the support for them to stay where they are. We've facilitated drop-offs, care packages, constant support, constant engagement, and the feedback from the large majority of people in the Binjari community are understanding and appreciative of that. And I pass on my deep thanks to you. It is not lost on us how strict it is to be constrained in the way that you are. But unfortunately, COVID has got a grip in your community. And on day 5, yet another individual in that community has now tested positive. Of course, we now have to find out all of those that she's been with and work through to at least day 5 results to understand if they also are positive. So it's made the length of the time further down the track, and that's disappointing. We'll continue to do the work that we're doing, again, to the Katherine community. I appreciate this will be disappointing news, but do understand that we are doing all that we reasonably can. We will try and close these gaps. We were hoping and trusting in human compliance, but unfortunately this has been a significant step backwards, and it's really, really disappointing. We've deployed more people. There'll be some further going down there to make sure that we've got appropriate fatigue management in place. As I say, it has been hot. There's a lot of agencies involved. There's lots of not-for-profits being involved. But to be really, really clear, there is a significant effort here to try and lift you back into the posture that we all want to be. And it is a disappointing day today in that regard. I just also want to touch on some rumour and innuendo that's going around. There's a persistent rumour that there's a positive case in Beswick. That is untrue. CDC have confirmed that again today. There is absolutely no link to a positive case in Beswick, so that's untrue. I'm also aware of some stories going around that emanated from the Cape in Queensland, as I understand it, about ADF apparently forcibly removing Aboriginal people. Again, that's not true, and it's certainly not a case that's presented in the Northern Territory at all. So, just for clarity, everyone is out there trying to help and support people. We've moved in excess of 236 people now into the Centre for National Resilience alone as a result of this cluster. There's a lot of things going on. Unfortunately today, it looks like we'll be moving at least 25, if not more people from Katherine into the CNR. It's all been done to support you, so please keep helping us to help you. Thank you.
Do we have an idea of how many hours this woman was in the community yesterday and today?
We need to track that down specifically, but we understand it commenced under the darkness of last night, and then obviously we managed to locate them just prior to 11 a.m. this morning.
And no ideas as to yet about venues that she was at?
That's something we've all got to work through. As you can appreciate, we only managed to bring her into our care less than half an hour ago, so we've got to now go through the contact tracing interviews as well as with the 3 others, and now unfortunately working with the 7 others that were there, as well as debriefing the taxi driver as to what other passengers he may have picked up and where they may have gone to and who he's been in contact with.
So the motive for this trip, is that yet known, or even
No.
any ideas? And I'm just wondering as well how police became aware of it. Did they receive a tip-off from someone in the Binjari community?
No, so we obviously were aware that a positive result had been identified this morning. The identification was such that we knew where the bulk of the people were, and a large number were already in the Centre for National Resilience, having been moved as close contacts. Unfortunately, this individual was a day 5 test in the Binjari community, and as a result of being positive, we attended there to try and identify and advise her, and unfortunately that's when we discovered she wasn't there.
Can we clarify the taxi driver's role? Has he been innocently caught up in this? Or
Highly likely, yeah. There's certainly no indication at this point in time of any other activity than just simply responding to a call for a conveyance from the caravan park.
Can I just ask, you mentioned before there was some mischief around about the information that's being fed to the people in the community about supplies, etc., I presume you were talking about. Where's that coming from?
Unfortunately, Matt, it's a common practice that there's a lot of experts out there and they tend to sit behind keyboards from afar and throw rocks without actually being the ones who step forward and try and do the bit on behalf of their community. So there is no basis to it. My Emergency Operations Centre, particularly through the Public Information Group and in intelligence cells, try and manage this information and become aware of it. And when they know that it's full and clear mischief, they ask me to speak out about it, which I've done.
And is this the same? Is this the same mode that information you're talking about, re Beswick and the ADF? Is that where it's coming from as well? Has this been spread?
No, I think it's a mixed message.
Chief Minister, I'm wondering if we can just get a bit of an idea of how concerning this day and development of 11 cases, I believe our highest number for this cluster as well.
In many respects, until we got the advice of the 11th case being at large, in many ways it was a good day. So the cases were positive but linked. You know, they were at Centre for National Resilience, so they were on quarantine in the Katherine community, they were close contacts, you know, so it essentially reinforced all the tracing work. And even the 11th case, the individual in Binjari had remained at her residence. We deliberately did day 5 testing. So this is, in the testing tempo, we expect there to be positives on day 5. So again, everything was working as it should have. The problem obviously was the person wasn't at home and was at large. And so we now have to do that contact tracing effort, new exposure sites, potential spread again. Having said that, we are immediately aware of it, so this is all immediate work, which is good, and a direct area of concern. But if that person had been at home, then in many ways today was a good day. Reasonable wastewater results, tracking in a good direction, Rockhole having a negative wastewater result, everything was kind of working to plan, test, trace, trap. Unfortunately, someone's got out and we now have to do a fresh lot of tracing efforts around the positive case who was known infectious in the community. She didn't know she was infectious, but we know the entire period of time she was in the community she was infectious, so these are absolute high-risk sites. Sometimes when we list an exposure site, that's not always the case. It's the potentially infectious, etc. These will be absolutely guaranteed known exposure sites now with a positive person. So other than that, it was heading in a good direction. It does concern me that we keep seeing young children being COVID positive. There are 7 cases that we don't have the details on yet, age or genders. They just came through positive earlier this morning. We're getting those details now. So of the 44 cases where we know the breakdown, 9, I believe, are now under 12. So it is, that does worry me a little bit.
Do you have a breakdown? How many of the 11 today, I presume the 11 today are all Aboriginal, and how many of the total cases do you know?
Because the 7 that we don't have, I don't have a breakdown on those 7. I haven't been able to get a breakdown on Aboriginality. So I asked some of those questions obviously earlier today about breakdown on back status, breakdown on gender, breakdown on Aboriginality. I don't have the specifics because those 7 are unidentified. Not everyone in this cluster is Aboriginal, but the overwhelming majority of people who are positive are Aboriginal. We should be able to have a decent... I should know the genders, ages, etc. of those 7 soonish. We're working on that now at CDC. So we should have a breakdown today of vac status and gender and Aboriginality. But even on what we know already, the absolute majority of people are Aboriginal. And so for those people who've been complacent and hesitant, and basically is complacency and hesitancy in most remote communities that are low vax, recognising most are high vax. Aboriginal people can get COVID. I think we've all heard different versions of the what do we call it? Rumour that this is a white fella disease. It's not a white fella disease. Aboriginal people can get COVID.
Given that's the case and that's the message you're trying to get out, we have this briefing here every day. Why are there never any Aboriginal people here giving that message that goes out on Facebook, which they're clearly watching?
Yeah. I think the majority of people who watch this are actually vaccinated. I think the people who need to hear this message now, the complacent or the hesitant, probably are not watching my press conferences. I think we've got an excellent vaccination rate in the NT. We've got some pockets of low vaccination. I don't think they're watching this. As you probably appreciate, say this is a cyclone emergency press conference. We often would have an interpreter speaking at that press conference because you usually talk to one language group. We have a significant number of language groups across the Northern Territory. So it's you have the spokesperson you need for the times, but we are absolutely doing conversations in vaccine, in language, in the communities that speak that language, or Creole, wherever it happens to be, so that is happening.
We know that a lot of people who live in these remote Aboriginal communities are also living in poverty. is dishing out $5,000 fines to potentially multiple people within one family, putting them at a disproportionate disadvantage.
I think if you've noticed across almost 19 months of the COVID emergency, police have very much gone with an education-based mindset, non-enforcement-based mindset. They don't willingly give out, $5,000 fines. Police are very much aware of what we're dealing with here, and will approach this with much care as possible. But we have the lockdown for a reason. In this instance, I think we can understand this is a quite significant breach of the lockdown rules. I know she didn't know that she was positive, but we have a positive case essentially in Katherine now for a significant period from last night through to 11 o'clock this morning. That's, we'll know the exact times later. That's more than 12 hours really in the community infectious. There's a reason these rules exist. It's hard to have rules and ask people to obey them if you never actually enforce them or implement them. I think people recognise you have to be proportionate in your responses. This is a health emergency. We're trying our best to, well, we're not trying our best. We are dealing with it as a health emergency. The fines do exist for a reason. I think police have been very sensible in when and how they've executed those fines.
Do you know how many people in hospital being treated for COVID-19 right now are Aboriginal?
I know there are 4. I'll pass to Dr. Payne to talk to the stats.
My understanding is that all of them at the moment are Aboriginal. There was some patients admitted overnight for assessment who were not, who returned to CNR. There were 2 children. So the vast majority of our admissions during this time have been Aboriginal people, and many of them with underlying conditions.
You're saying 4. It's definitely 4, not 5 people in hospital?
At the moment, 4, yes.
Can we get details on each of those 4 cases then, please?
I won't, not now, and actually my preference is not to give those details. I don't want to disclose individuals. What I will give is an update on the status of people in terms of their condition. At the moment, those patients that are there are stable and are not requiring intensive treatment.
To be fair, we started this outbreak with that information. I think public transparency and accountability does require a degree of information. Obviously, patient privacy is one thing, but understanding the age and whether their gender and if they're Aboriginal or not, I think are key and reasonable things for the public to expect.
Yes, and we have done that, and I'm happy to continue to do that. What I don't want to do, and there has been concern about this, is to disclose details of people's ages and gender and Aboriginality, because that so often with small communities identifies individuals.
From the Cappy Day exposure side, how worried are you about that situation, given 4 positive cases separately went to the same venue?
Yes. Well, clearly, as the Chief Minister said, that's of major concern. And obviously that's some time ago. We're coming to the end of the time when we'd expect people to become infectious from that exposure. But of course, we've got to revisit that, and we'd ask people to come forward if they've been there and identify themselves to be tested. Okay.
Dr. Payne, yesterday you expressed what I might describe as bewilderment at those who are vocally opposing vaccination, and even federal politicians in Canberra. Do you think that's impacting your ability to roll the vaccination out in some of these remote communities?
Yes, whether or not their views are influential, but there are certainly views that are highly influential, we know, in some communities in the territory. Sometimes it's from religious groups who have some aberrant views. They're not mainstream views in those religious communities. And there are other anti-vax ideas that have become very influential, that have created fear in people about vaccination. They have undoubtedly had a major influence on people around Australia and in the Territory. We're working very hard to try and counter those views with evidence and information. I think what's staring in people's faces right now is that we have an emergency. We have a pandemic that is visiting us intermittently in the Territory. Sooner or later, it is going to come, and then everyone will be exposed. Everyone who hasn't had the vaccine will be at risk from getting COVID seriously. Everyone will be exposed even if they've had the vaccine. And of course, those who've got their immune systems primed and prepared by the vaccine will get it mildly, mostly. Some people, even if they're vaccinated with underlying conditions, can get it seriously. People will be seeing that. So that might concern people that it's not protective, but of course it's highly protective of people, even if they've got underlying conditions. So everybody needs to be prepared. Everybody needs to have their immune system prepared by vaccination.
You've mentioned...
About the lockdown though, the Katherine lockdown, 6 p.m. is supposed to come out. I haven't heard clarity around whether or not it's been extended or to when it's been extended to.
We haven't made a decision. We have said that it will be 4th of December. That's our time frame, but the question is what form of lockdown.
Confirming yesterday, we advised that Katherine will remain in some form of lockdown until the 4th of December. For clarity, the Cho direction will simply say lockdown and the 4th, and then obviously between now and the 4th we might make a decision to go into a lockout. But Katherine will remain in some form of lockdown or lockout until the 4th. Today's positive case may reset that clock, unfortunately, for the people of Katherine, because that's a positive case in the community. It's normally 14 days from the last known potential transmission in the community, so a replication cycle. We have to do that tracing work now to identify that. It may be that all close contacts from the person who's positive in the Katherine community are identified and moved, and there are no other contacts. You know, if it was as simple as that, But it may be that we have to reset the 14-day clock as a result of what happened today.
You've had,
Today.
sorry, Chief, you've had,
right.
and I'm not sure this might be better for Dr. Payne, but you've had positive wastewater tests in Marlow Lagoon, I think, and Berrima now. In
Presumptive
the past.
positives, yeah.
What's the likelihood that the virus is actually in Darwin and we just don't know it yet? It hasn't been picked up in our testing.
So I'll pass to Dr. Payne, but we had a presumptive positive in Marlow. We asked people to come forward for testing. They did. And then the next day's test came back as a negative. So that's good. We've got a presumptive positive in Berrima. So it's a similar thing. We ask people to symptomatic come forward. And we'll keep obviously measuring that wastewater. It might be that, again, I'll pass to Dr. Payne around how the testing work. It might be that it clears up tomorrow and it's nothing to worry about. So it's carefully keep perspective around the wastewater. It can be reliable, it cannot be reliable. It's informative, not determinative always, but I'll pass to Dr. Payne. There are times, depending on the signal strength, that's very useful.
Yes, I do need to make it clear that it's presumptive positive. So we've had a series of these, as you will have noticed. Presumptive doesn't mean confirmed positive. Sometimes those can be false positives. So what we do is we obviously repeat the sampling, but we also run the test again on that sample. So we will do that. And as the Chief has said, with Marlow Lagoon, subsequent tests were all negative. So that was clearly, well, I can't say it was a false positive, but it certainly wasn't confirmed as a positive. So we're in a surveillance mode, if you want, to understand it that way, as we are for a whole range of sites across the territory. I'd reassure people that we now have explanations for all the clear positive results in the territory. I'll just come back to Katherine East. That result has been declining in its signal strength, which is consistent with what we're seeing with the cases and the epidemiology there. But last point I'd make on that is we still need people, please, to come forward and get tested in that community, because we can't trust that those cases that we know of are the only explanation for that positive wastewater.
You've said a couple of times, it appears you've indicated a couple of times that even if it's not this outbreak, it appears from your language that you believe it's a matter of when, not if, we're going to have a widespread outbreak in the Northern Territory. Is that fair?
We are going to have outbreaks. There's no question about it. It's only a matter of time. We know what we are intentionally doing as a country. We are returning to normal on the basis of our vaccination rates. That's the critical dependency here, and we will return to normal gradually with the protection of the vaccine. But I reiterate again, it's dependent on that. Now, we're doing extremely well in the territory. We were leading in the territory. We have had some significant resistance. You see people marching in the streets, but we've also had some significant hesitancy. We want to get to those people who are still hesitant. We may not persuade those who are resistant, although surprisingly some of those people are somewhat secretly getting vaccinated. But But the hesitancy is the issue, and we need those people please to come forward.
There are a couple of experts who are quoted in the Age newspaper today, medical experts, saying that some of the language from the politicians that's been stridently anti-vax, and we've seen it from the Chief Minister, is perhaps not helping in this situation, that those people who are hesitant are perhaps becoming completely anti-government as a result of some of that language. What are your thoughts on that?
Well, I was here, of course, when the Chief Minister made his speech, and I have to say I was delighted with it. I suppose some people may become more stubborn when they're pushed. I would appeal to the reason of those people. Just try and appeal to their logic. Just look at what's happening, look at the evidence, and try and overcome your stubbornness.
People in Katherine East have previously been, it's my understanding that everyone in Katherine East has previously been advised to go and get tested for COVID-19. Is that true? Is that ongoing?
I'm sorry, I slightly missed the beginning of your sentence.
I asked a bit crazy.
Please go ahead.
So I understand that residents of Katherine East have all previously received a text to go and get tested for COVID-19.
Yeah.
Is that still happening? Like, are they getting more texts?
I'm not sure if they're getting follow-up texts, but they are getting door-to-door visits and being offered testing as well as vaccination. And the uptake has been quite good in the beginning. We expect it to increase because we've really been mobilising our efforts there over the last 48 hours.
Commissioner, just want to clarify something about the 4 individuals who called a taxi. Did they leave Binjari before ordering a taxi, or did the taxi walk into the community?
At this stage, what I understand, they're seeking confirmation on it, which will be done once we do the full contact tracing interview, is that they walked to the caravan park and made the call from there to be collected from there.
And just as well, an operational question. We know about the transport of people from Katherine through, I assume it's in the workplace, through aircraft to Howard Springs. How are people being taken from Binjari to Tyndall?
So we've got buses. I'm not sure if you've seen some of the imagery, but it's already been out in the public domain. So they've got plastic literally all over the seats. All the people who go on board have got appropriate PPE. The drivers have got appropriate PPE. They're separated by as much physical distance as we can, so they're quite a large bus, and then they're decontaminated at the result of each trip.
You touched yesterday on the idea of people who may be bona fide Alice or Darwin residents stuck in Katherine. Are we hearing any more about that and what the transport effort's been like?
So the teams are working through that process just to ensure that we can put it into practice. I don't think we're too far away, and once we do have that up and running, we'll get that out in the public messaging.
On the changes to border restrictions, I think the Chief mentioned on Sunday or Saturday that people arriving to the territory from Monday will need to be vaccinated, double vaccinated. Does that apply from green zones as well? And what happens if they fly into the territory and border checkpoint figures out that they're not double vaccinated? They put back on the plane and sent to the state where they came from?
In essence, the people, as I understand it from the green zone, are still allowed to enter if they are unvaccinated. No, sorry, that they're being turned around. The process is such that the teams are well drilled on what the specific show directions are in that place. We send the message out about what is acceptable, who can come out. Everyone's referred to the COVID-19 website to make sure that they're up to date with those things. And the case is that if they turn up here unvaccinated, they are directed to leave on the next flight.
And last couple, please, guys. Just on the 4 people in hospital, do we have an update on whether there are 2 people who are requiring oxygen yesterday? Are they still requiring oxygen?
My understanding that they're intermittently, but their condition is stable.
And so overall, you can say all 4 cases are stable?
Yes, they're all stable, definitely
and
stable.
2 are requiring intermittent oxygen?
Intermittently oxygen, that's my understanding. Yep.
Could I just get an update on whether there's any significant waiting times for testing at the moment? So there's been sort of reports that it's taking up to 48 hours to get a result back.
Yes. Well, the reporting function is a separate thing. So the laboratory has much greater capacity than we're actually using. So they're able to turn those results around in usually 24 hours. So I don't think there's an issue on the laboratory end, but there may be an issue that I'm not aware of in terms of getting the swabs to the laboratory so that we can get the turnaround time from the laboratory. Our system is working very efficiently. If there are any issues with it, obviously we'd be welcome any information on that.
Thanks, everyone.
Michael Gunner, can we just ask one very quick question on the matter of availability of rapid antigen tests to get to the to remote communities? Obviously, these aren't the ones that are affected, but the rules were below 70 back to need rapid antigen tests. We've heard from some people who have got contractors going out there, they're all compliant with all the other regulations, but are struggling to access rapid antigen tests. Is it the case that Palmerston, Marara, or pandemic centres will have those tests available and that people won't need to look to get them?
Yeah, so I'm not aware of any issues in that space. If the contractors having that experience and they're not putting it into us to deal with. So we've got obviously those RAT tests set up for Alice, Katherine, and well, at the moment Katherine requires a PCR because of the Katherine situation, and Darwin. The reports I'd had, they were all sort of working. So if there's contractors contacting you of issues, tell them to contact us and we'll get it fixed. All right, thanks all.